know, we've been talking about adjusting our home-based care program so that we start working with the family and not just with the patient. We've also been doing nutrition education with Helen Brzezinski about 3 years ago. Monica and Sika and her team have been doing food gardens. We've also been with Barbara and staff and Gibby distributing food parcels. And one of the things that we've found out is that we're not integrating the three. So that if we're providing food parcels, it needs to be complemented with the type of veggies grown in the garden. If we're doing nutrition education, people need to learn to use all the variety of veggies that they're growing in their garden. Because at the moment, before we only planted cabbages and potatoes, now we have varieties such as brinjals and peppers and broccoli. If that's okay. This is a joint venture that's been done with Ikamva Labantu, Answer, Avi and his team, who's the agricultural experts, as well as GAP, Goals and Performance Organization, which is run by Zozo. She comes in to do the organizational development part. So this is a joint venture. It is actually very exciting. This is the process that took place in the last 2 weeks. First, we reviewed Ikamva Labantu's vision and mission to ensure, because this program has to fit into that. One of the things we've recognized is that in the mission statement, we also need to include here on what we mean by development when we say development. One of the principles of development is that we recognize that communities have to do for themselves. Communities represent a vehicle for social change and have the potential for changing their own circumstances.
Amen.
Ikamva Labantu will build on that potential, and we will create hope for the individuals. That process continued. We also did an environment and needs analysis. Very briefly, not in detail, we did a SWOT analysis. We also did a stakeholder analysis of our various sectors to ensure that we have successful collaboration across all our sectors. And also to look at what are we doing in our sectors around health and around food distribution. So we explored that as well because we want to build on what we're doing currently and not coming with something new. So there we already applying our principles of development. Strategic approach to this particular program is that we don't want to do it all ourselves. We want to network and collaborate with our partners, with our funders, with corporate companies, as well as with the resources and organizations within the communities. We want to promote dialogue, organizational capacity and development. There's nowhere we can go forward if we do not have the skills and the staff to roll this out. Relief provision, as well as training and knowledge building.
So out of the 2 weeks, 3 key goals emerged. The first goal, which spoke directly to the general organization of Ikamva Labantu, it is to improve, develop organizational capacity, competence to respond to the basic health, nutritional, and review the current food parcels in terms of is it culturally acceptable. The whole discussion of lentils that came up over the past 2 weeks, the things like broccoli. So it's also about maybe not necessarily taking things out of the food parcel, but to also educate people that's doing the preparation of the meals in terms of how to actually make the meals. In with goal 3, which is our more long-term goal, it's creating sustainable livelihoods. Advance interest in business opportunities, develop general business acumen, emphasis on the role of economic growth in achieving sustainable development. Where this came from was a lot of what Abby was talking to us about, the rural areas and also the lack of the youth being involved in actually agricultural activities. So we were thinking, we change the focus and not just look at agriculture, but we take it from a business perspective. So we're saying to the youth, that come and learn business skills, and we also then introduce them to the agricultural components, whether it be growing the veggies in the garden, or whether it is actually running a little business, selling the veggies, or learning how to prepare, so to become chefs. We've got specific objectives, which we broke down into action steps. Action steps mean exactly what needs to happen, so that each objective is actually being met, and who's going to be doing it, and time frames attached. Some of them were, actually no, not some of them, all of them are basically going to be managed by teams. The whole approach that we use with the MGROW and that we're using with the multi-purpose centers, so key people are going to be involved in that team to take this whole process forward. Because down the line we're looking at employing a manager that's going to oversee this whole process. But in the interim, we need to get the ball rolling and get it off the ground. Then the action step speaks to key plans, which on the next page I'll give you a bit of more understanding of what are the plans. And then all of this feeds into a pilot program or pilot programs. And the two sectors that we're going to be using is family services sector to test our plans, and we're also going to use groups for hope. And it's all around the whole to see how effective the plans are, building a foundation for the management knowledge. So what our learnings out of the pilot program is going to help us in our strategic planning. So it's going to be that whole action reflection cycle that we spoke about in last year in our field meeting. So we're going to do things and we're going to reflect on it and we're going to make the necessary adjustments.
And there's also community gardens.
Yes. Oh, sorry. When I refer to plans on the previous page, this will give you an idea of what are the plans that we're talking about. Do you want to call me back, Ellen?
I just said please.
But we're going to speak on it again, so maybe just give me a second.
Otherwise, it's not part of this. Thanks, and Nelly's job more hard. She's got to hold it together.
Rosario, while we was talking, I was looking at terminology. Would plans be programs for
You've been summoned back.
Okay, here he is. Okay, got him back. You want to just go and say about the three key programs that are.
I'm going to speak about it again now, moving into the plans. So we'll take one minute every time. Now we spoke about plans. Where did these plans come from? From all the discussions that happened over the 2 weeks and key things that were identified, we saw that food was a key component that kept coming up. Food being the parcels, the snacks, as well as the produce from our community gardens. Educational needs around our nutrition and health, as well as monitoring and evaluation. So from this, it led to the development of, the other thing that we could add on here was the economic empowerment. So out of those, from those 4 components, we then designed the 4 key areas within our plan, which is going to be rolled up into the pilot sites. The first one being monitoring and evaluation, the food parcel program, the nutrition, health, education and planning, the economic employment empowerment plan. These are the 4 plans which is going to be running through the pilot projects, which is the family services sector, the community gardens and Groups for Hope. So that's basically the nuts and bolts of the kit. So that you know that these 4 made each and every component to actually achieve this. And because it's pilot, we're going to be evaluating how effective we are in actually implementing these.